So referring back to our Venn diagram, we're going to talk a little bit more about where stabilization and normalization occur and what this might look like and some points you might consider as you're moving from stabilizing to helping the student to normalize. Again, our goal here is to help students understand their reactions. They need to know that intense emotions may come and go in waves. You know, I don't know if you guys have ever had a loss of any significance, but you know how it is. You're in shock, right? And then other feelings may emerge, such as guilt, anger, sadness, and then you'll have a moment where maybe after praying, maybe after being with family and getting consoling, you feel all right. You feel like life's going to go on and I'm going to feel fantastic and it's going to be permanent, but then a wave hits, right? And waves, they may never stop. They may increase or decrease in size, but especially in the days, weeks, and sometimes months following a significant tragedy, depending on how close to the situation the student is, their emotions, they'll be, they'll feel like they're in control one day, and then the next day, they'll feel like it's overwhelming. And so that's one of the reasons why when we're talking about adaptation down the line, we'll need to, they'll need to have that understanding, because when setting up outside supports or when seeking outside solace with friends and family members, this can provide motivation for them to do that. It is also important for students to know that when they're experiencing these, fringe and significant, tragedies, they can be shocking and they can trigger very strong, upsetting alarm or startle reactions. So we may see behaviors emerge in us that we're unfamiliar with because maybe this is the first time we've dealt with a tragedy. Maybe this is the first time we've been caught off guard with the loss of a teacher that we really liked, or the loss of a friend, or the loss of somebody that's a friend of a friend. And so when students are seeking, or when students appear confused, or they're not really understanding what's going on, empathize with that. Help them to know that they're not alone in that, and that it's rather normal, so to speak, to have reactions that are alarming or startling that you've not experienced before. It is important that, during these times, especially as you're stabilizing and normalizing and the two are merging, helping the student to calm down, because in order to fully normalize with a student, they really, really need to be thinking reasonably. So we know that when we are, in shock, or we are being, thrown for a loop emotionally, the best way to calm down is sometimes by using relaxation techniques. And this is a perfect opportunity to help practice them. Okay? We are seeing a little bit of adaptation start to overlap. But in this instance, you're using a component of adaptation in order to help stabilize so that you can get to the normalization piece. So breathing, muscle relaxation, walking, etc. Okay? So we'll go over these techniques later on in the presentation, and we'll walk through them together, and you can practice them right here with this video. Also, friends and family are important sources of support for calming. Again, as mentioned before, hey, if this student has a friend that might be of support, bring them together. When we've had tragedies with students in the past, we oftentimes bring students together after we've met with them individually, after we've provided other supports, other more basic supports. Maybe there's food, maybe they need food, maybe they're hungry, maybe they lost sleep, they're tired. We provide them with that individual support, kind of like the necessities on Maslow's hierarchy of needs. They need safety, they need shelter, they need food, they need sustenance, and then we provide that support. We provide that community, right? Whether that looks like parents, friends, or both. I remember my father, he passed away back in 1999, and I was absolutely blown away. My heart almost exploded with joy when I was there. I was feeling really horrible about it. I was 18 years old, and my soccer coach from Schreiner University, he contacted all of my close teammates, and they all came to the ceremony, to my dad's funeral. I was absolutely affected in ways that I can't even describe. And so at that point, my friends were my family. They were my soccer team. And my family was also there. And I found solace in both, but it was really nice to have a combination of the two. So in any case, you may ask a student, hey, do you have a close friend that you'd like to be in here? Do Do you have somebody that, really gets you? Because I'm learning about you, but that may help. And you may be surprised their response. They may say, sure, yeah. Again, they may say no, but it's worth asking. Okay, so let's review some stabilization techniques. So, extreme agitation, rush of speech, persistent and intense crying are all those, fringe responses, those elevated responses that are on the way, way far end of the bell curve as far as intense, stressful, and anxious reactions. There are three things that we can do to help reduce this and to help them ground and stabilize and orient. The first one is grounding techniques. The second one is relaxation techniques. And the third one is entrainment techniques. Okay, so when we're beginning a stabilization technique, the first thing we want to do is ask the person to listen and look at you. Okay? If they're all over the place, you ask them nicely, calmly, in a calm voice. You never want to match them with their elevation. You sometimes may need to, go where they are with their level so that they can hear you. I mean, if they're wailing, you want them to be able to hear you. So you may need to raise your voice, but then you lower it and bring them down with you. You find out if they know where they are and what's happening around them, what day it is. Are they oriented? If they don't appear oriented, then ask them to describe their surroundings and say where you both are. If they're successful at this, then you probably don't need a lot of grounding techniques. Maybe some breathing might help, some meditation. And all this may not be necessary, but it will help to ground them, whether a kid needs moderate intervention or, significant intervention with regards to stabilization, these questions, are sometimes helpful, but sometimes, they may look at you like you're crazy because they're obviously quite calm as they come in. So, use them with your best judgment. So let's define grounding techniques. So you would introduce the technique by saying, after a frightening experience, you can find yourself overwhelmed with emotions or unable to stop thinking or imagining what happened. You can use a method called grounding to feel less overwhelmed. Grounding works by turning your attention back to the outside world rather than being internal in your head. Here's what you do. You sit comfortably with your arms and legs uncrossed. Mind you, during this, you're modeling it. Okay, we don't just say it, we do it. You breathe in and out slowly and deeply. Look around you and name 5 non-distressing objects that you can see. For example, you could say, I see the floor. I see a shoe. I see a table. I see a chair. I see a person. And you breathe in and out again, slowly and deeply. You continue this process, but you insert other sensory techniques. So, next time you do it, after you breathe, you name 5 non-distressing sounds that you can hear. For example, I hear a woman talking. I hear myself breathing. I hear someone typing. I hear a door closing. I hear a cell phone ringing. Then breathe slowly and deeply again. And finally, you name 5 non-distressing things that you can feel. For example, I can feel the wooden armrest of this chair. I can feel my toes inside my shoes. I can feel my back pressing against my chair. I can feel the blanket I'm holding. I can feel my lips pressed together. Breathe in slowly and deeply.